is Dr. Lori, and in this short video, I want to tell you all the ways that you can get the most out of your session. And I do mean that in the most literal way possible. Before I go into that, I want to just make sure that you do not have any of the following symptoms and make sure that you are a candidate for this therapy. If you have any rectal bleeding from hemorrhoids or bleeding in general, that's one reason that you'd be very uncomfortable and you'd want to go check with your primary care physician why that is happening. Secondly, if you have any blockages or if there's anything that's sharp pain in the colon or in the gut, or if you haven't gone to the bathroom in 3 to 4 or longer days, then definitely check in with your doctor as well, just to make sure that there's nothing there and we're not aggravating any situation. The other thing is if you have an active Crohn's flare-up or if diverticulitis, any acute issue that you're suffering from, colon hydrotherapy may not be the right step for you to do at this time. Lastly, we do not recommend having these therapies in your first trimester of pregnancy. So if you suspect you're pregnant, definitely do not have them right now. We've had some patients who have signed consent forms saying in the first trimester that they're so uncomfortable and they feel like they need to have a colonic. So they signed a consent saying whatever could happen, it's your liability, because I do understand, having 3 children myself, that constipation can be part of the pregnancy process, and when you need that relief, that's also an important step. So the therapists are very well trained in all of these scenarios, and they can discuss with you the different options and how the colon hydrotherapy session can be personalized to you and your needs. So the days leading up to the colon hydrotherapy session, you want to make sure that you're drinking a lot of water. If you suffer from constipation, you may need to increase your magnesium citrate consumption. So magnesium will help pull water into the colon and just soften up stool, and therefore the colon hydrotherapy session will be more effective on releasing the stuff that may have been stuck in the bowel for a long time. You can also try doing castor oil packs. Castor oil you can get from any health food store. You'd want to get the hexane-free oil. You can apply that to the abdomen, to the lower abdomen where the colon is, and also to where your liver is. So right under the right rib there, you can put castor oil there with a heating pack for 20 minutes, a few nights leading up to the colon hydrotherapy session. That will help just soften up stool, bring down inflammation, and make sure that the session is as powerful and effective as possible. Now, a lot of people ask, should you fast the morning of the colonic? I personally recommend that. Personally, when I have them, I try to schedule the colonics first thing in the morning. However, if your appointment is later in the afternoon or in the evening time, which is completely fine, I would just keep your meals light that day. So for example, don't have a huge steak and potatoes and things that you just know are heavy on your gut, because you may get more cramping in that session. So leading up to the colonic on that day, have a smoothie, have something that's very gentle, maybe soups or salads. If you want protein, stick to more like fish and eggs. Those are okay. Go by what you feel would be the least amount of energy needing to break up that meal, because all the energy we want to be focusing on is releasing and get rid of stuff that has been sitting there for possibly years. So it's a very exciting time to get rid of a lot of the things that have been impacted. The first colonic that you have, you may not get a lot out because the stuff has been sitting there for so long, but you can expect to have possible parasites come out the first time, candida, yeast. You may be getting some undigested food coming out, mucus, or even acidity. So it's really nice for the colon therapist to assess everything that's coming out, and she'll give you a really great plan as far as how you can move forward. The other question that we get quite often is, what should you wear to this appointment? I would highly recommend just coming as you are, whether that's in your pajamas or in your work clothes, however you want. This is something that does not matter, because you are going to be undraping from the waist down, completely covered the entire time. So we will have you get out of the clothes that you come in. So don't worry about wearing anything special. It's something that just come as you are, whatever is easy for you. The other question that we get asked is, if you need to schedule this appointment away from a work day or on a weekend or a time that you're really not committed to anything else, because the thoughts are you may be spending hours on the toilet after, and that is not the case at all. So a lot of people can come in on their lunch break at work, they can come before they start work or come at the end of the day. This is something that when you come in for the appointment, generally it's about a 30 to 40 minutes on the table, and then you spend about 15 minutes afterwards on your own in the washroom just to release any residual water that may have been sitting in your gut still. So once you sit up and gravity takes effect, you'll spend another 5 minutes just sitting on the toilet, or less or more. It really depends on how your treatment was prior. And that's something that once that hour of the treatment is done, then you just go on with your day. I would highly recommend, though, you don't go to the gym directly after, or you do something that's really intensive. When you are detoxing and your body is releasing things, you want to just take it easy the rest of the day. So it doesn't mean you have to go for a nap or you have to just like completely lay low, but you don't want to do anything too intense. And also afterwards, you want to make sure that you have electrolytes, which we provide in the clinic, and then also fill up on the prebiotic and probiotic foods. And the colon hydrotherapist will make sure to go through all of that with you, which diet you want to stick to, what's easiest on your gut, and how to replace the good bacteria after a session. The last thing you want to do is go into the keg or go to have like a big steak after that session. Now, if you've never had a colonic before, you may wonder how often do you have to have these sessions to get the results that you want? And that question is so personalized based on what your history has been and the reason for you coming in. Personally, for me, I try to have them 3 to 4 times a year, usually around season changes, just to help reset my gut and make sure that I'm getting rid of things that should not be there. So it's more of a maintenance plan for me. And it also can help keep me on track. So if I see a lot of things in there that just really should not be in there, then it's a reminder of, okay, I need to change my diet. Maybe I need to increase digestive enzymes. Maybe I need to do an anti-parasitic plan or things to help repair what's going on and what I'm seeing. So generally the protocol could be once a week for 6 weeks if you have major constipation or if you have a lot of other digestive issues. I actually really like when people do 2 times in a week, so back to back. So just say a Tuesday, Wednesday, and then they do that for a few weeks as well. So the answer really does depend on you and what your goals are. I find when they're back to back like that, you just get more of a release, because the first time, like I said, maybe you're just releasing gases or you're just releasing some acidic water. You do have to have many where you're getting really to the root of the issue. I've seen where after the 12th colonic, someone has passed like massive parasites, and that really is the goal. You want to get rid of the things that are just really embedded in the gut that's not usually passed after the first colonic. So I hope this video helps. If you have any other questions, please reply to this email, because we want to make sure that you're completely comfortable and you feel heard and you know that this is the right decision for you to do this therapy and you feel completely safe and supported throughout.